Yes.
Better for younger people, just people cells lose potency as they age, for example.
They do lose potency, but remember what we're trying to do is we're trying to take the best that the body has to offer and effectively supercharge it and reintroduce it back into the body because the cells of that individual can't function in a manner that's consistent with what those cells are originally intended to do because the very harsh environment of where they're located. So as you get older, your discs begin to, you either it's an injury or some trauma or some slight lacerations or protrusions of your disc. Once that happens, because of where it's located, it's kind of a design flaw of the human body. If you think about it, the spine, it's supposed to bear all of this weight, but we only have two legs, and it's all on the spine. Unlike an animal that walks on four legs, so it's distributed more evenly across the body. This is all on the spine, and as you get older, the cells, the tissue, the environment becomes a little bit more corrupt. And once it begins to get injured or begins to degenerate, the adjacent spaces also begin to degenerate, and you have this cascade effect. So what we're looking to do is capture that patient on the early onset of that degenerative process and change the environment of the disc so that it becomes a healthy disc again, bringing healthy cells that have been supercharged from the standpoint of being able to resist those harsh environments, and they can begin to communicate and signal and proliferate and scaffold within that environment and bring you back prior to that injury. We are seeing radiographically the resolution of annular tears and lacerations of the disc, which is unheard of. No one's ever seen that before. So it's not just subjective data points where, patients are saying, I feel better, I've got a reduction in my pain score or an improvement in my functionality score, but I'm seeing real objective data points that would indicate that the mechanism of action is actually working.